Hello and welcome. So I hope that we have lots of people chimed in today because starting tomorrow, things are going to look different around here. And what I wanted to do was walk you through the changes that are going to happen. I know that it's been a long 3 months of not being able to see your loved one. And I know that, half an hour of visit once a week isn't very much either. So what we've done is we've tried to make your visit a little more special and a little bit more meaningful. So thanks to a generous donation by Honda, who donated the tent, and thanks to our board of directors who designed and built the visitation booths. We have a hugging station as part of the booth, and you'll be given gloves and you'll be able to put your arms through the holes in the plexiglass and hold your loved one's hand and maybe even give them a hug. So we're hoping that will make it a little bit more special for you. And I know it doesn't seem like enough, but hopefully we're progressing. And I'm going to talk to you today about phase 1. I will highlight phase 2, A and B, and phase 3, but I won't get into them because there's a lot to cover today. And it can get confusing when we start looking at all the different phases. I also wanted to share that last week, the staff all were tested. Results are coming in and they're all negative, and we haven't had a call from public health to tell us that anybody has tested positive. So we're feeling pretty good about that. So visitation will begin tomorrow at 1 p.m., but let me take you through the steps to how we're going to get there. So we were required to develop a policy to address visitation. Not only did we have to follow the guidelines that I've previously distributed to you, but we also needed to follow a very comprehensive directive from the ministry regarding visitation. Both of these documents have laid the foundation for the policy to ensure compliance. So we had extensive discussions on how we were going to manage our visits, what would be the best for the residents, for the family, and also for our staff, and as well as whether or not what we could handle in terms of visitors. So the policy, we have addressed all the phases, and as I mentioned, we're only really going to talk about phase 1 today. So let me start. I'm just going to go through the highlights of the policy, and that will help you understand where we're getting to. So the policy is under our Infection Prevention and Control Program and sets out the procedures for resuming visits after the pandemic restrictions. The goal is to ensure the health and safety of residents, staff, and visitors during and after a pandemic, when no vaccine for the virus is available. Our objectives are to allow residents and their loved ones to reunite in person in a safe manner during the COVID-19 pandemic. To prevent the pandemic infection virus from infecting any residents, staff, and visitor. So with phase 1, we are looking at what is defined as non-essential visitor. And that would be any family member, close friend, or neighbor. We want to consider risk factors that exist. There may exist an immediate risk to the health of persons anywhere in Ontario from COVID-19. There is a significant risk that BRHD residents and/or staff and any visitor could be infected with the COVID-19 virus during visitation, and for BRHD to have to declare a COVID-19 outbreak if appropriate protection is not taken, and the same persons do not follow the proper procedures as outlined below. So basically that's just saying we all have to do our part to make sure that the virus doesn't get into the home. In resuming visits between BRHD residents and visitors and between residents and essential visitors, all persons involved in the visit must take the necessary precautions as outlined in this policy and procedure. So our staff have had training in infection prevention and control relevant to their responsibilities and position. And based on the staff members' assessed needs, Visitors will be given, and I think I've already sent it out, Visiting Your Loved One in the Time of COVID-19, which is a brochure, as well as mask information and information on how to don and doff PPE. A copy of this policy will be communicated to residents and their family members. 1, 2, 3. So, non-essential visitors, pre-visit non-essential visitors. Prior to scheduling the visitation, you should consider your personal health and susceptibility to the virus for both yourself and the resident that you wish to visit. Where it is not possible or advisable for an in-person visit, we will be continuing with virtual window visits, Skype calls, and FaceTime. The loved one must schedule the visit with Amy Skidmore, that's our communicator and now our communicator or her designate, and she's now referred to as the scheduler. Amy may be contacted Monday to Friday, 9:30 to 4:30, and can be reached at our number 705-719-6700, and her extension is 309, or by email askidmore@bobrumble.org. Pre-visit information for non-essential visitors. Every resident is allowed an opportunity to have at least one visit by one person weekly. The visits are to be not less than 30 minutes, weather permitting as applicable. So as I mentioned, Honda had helped us to build our booths. They are in the courtyards of Care Center 1 and the courtyard of Care Center 2. To ensure sufficient time for screening, transporting the resident, monitoring the visit if necessary, and disinfecting practices between visits, and to allow families and friends to visit their loved one each week, scheduled visits at BRHD will be allotted in 30-minute maximum. At the time, BRHD reserves the right to not schedule more than one visit by one person once a week for each resident and that's related to our staffing availability. BRHD also retains the right to prioritize visits based on the needs of residents, and that might be due to a relative clinical or emotional decline, and to remove the resident prior to 30 minutes if the resident is unwell or is not tolerating the visit. High risk for heat-related illness, etc. Visits will not occur during meal times in phase 1, as the staff will be busy helping residents with their meals. Here's some reminders for non-essential visitors by the scheduler. If BRHD is in an outbreak, there will be no visits, period. Visits are not permitted when a resident is self-isolating or is symptomatic. Please do not bring pets or any food or beverages with your visit. Outside visitors will not be allowed into the home and not be permitted to use the home's washrooms. Visitors should arrive at the home with your face mask for outside visits, no earlier than 5 minutes prior to your scheduled visit, so that the visitors have time to be screened and sign in, and to prevent crossing paths with other family members. You must pass the active screening test, which includes a written attestation to the fact that you have had a COVID test in the previous 2 weeks and tested negative. Schedule for gradual reopening of BRHD to visitors and implementation process. Phase 1, outdoor visiting only. Effective date, Thursday, June 18th, 2020, 1 p.m. Type of visit, outdoor visiting only. Number of visitors allowed, 1 visitor at a time per resident. Visits will be allowed once per week minimum. Scheduling of visits, yes. The outdoor visit must be scheduled. This allows for appropriate physical distance and staffing coverage. The maximum time for a visit is 30 minutes at this time, and that is weather permitting. to allow for meaningful and equitable access to visits for all residents, and with consideration for staffing and space capacity available to maintain the safety of residents, staff, and visitors. Scheduled outdoor visits may be arranged at the following times, starting at 9:30, 10:15, 11, 1 p.m., 1:45 p.m., 2:30 p.m. I will send this out to you. 3:15 p.m., 4 p.m., and 6:30 p.m. BRHD is not able to schedule more than 64 outdoor visits per week. There will be a 15-minute between visits to allow us for portering the resident, screening the visitor, and sanitizing the booths. Process for outdoor visiting, phase 1. Non-essential visitors to schedule their visit. Visitor provides his or her own face mask and must wear it as appropriate during the visit. If you require a cloth mask, one will be provided to you. The visitor is to arrive no earlier than 5 minutes prior to the visit. Take the sidewalk on the west side of the building to the appropriate courtyard for visiting. Ensure physical distancing from any other visitors or staff. Signage will be available to direct you. The visit supervisor will let you in at the appropriate courtyard gate. Please wait behind the black line until you receive further direction from the visit supervisor. Please review the infection prevention and control information and complete the written attestation. This will be the screening. The screener will conduct the screening test and document responses on the screening tool. The visitor must answer and pass the screening test in order to proceed. And again, the visitor must verify through the written attestation to the fact that they have had a COVID test in the previous 2 weeks and has tested negative and has subsequently not tested positive. And as far as we understand, this means that you need to get tested every 2 weeks. And also to make sure that you are not experiencing any kind of typical or atypical symptoms. The signed attestation will be retained with the screening tool. And we are not responsible for providing COVID-19 testing. Visitors agree to comply with our infection prevention and control protocols and practices as the home as directed, and the information provided, including but not limited to use of face or surgical procedure masks as appropriate, good hand hygiene, alcohol-based hand sanitizer, good respiratory etiquette, sneeze and cough into your arm and sleeve, donning and doffing PPE, and to wear the PPE as directed by BRHD staff. The visitor also agrees to practice physical distancing, a distance of 2 meters, 6 feet from one another, except when at the visitation booth. Signage will be available. The visitor will be greeted by the visit supervisor and escorted beyond the gate to the visitation booth. The visitor will be instructed to use hand sanitizer and put on gloves that will allow you to touch the resident behind the plastic area. The visit supervisor will bring the resident to the booth and monitor the visit as required. The visit will be for a maximum of 30 minutes. Note, the visitor will not be allowed to enter the home or use the home's washroom facilities. After the visit supervisor will return the resident to his or her room or designated area. The visitor will remove the dispose of gloves, hand sanitize, and ensure that their face mask is in place. If the visitor was loaned a face mask, please place it in the soiled mask in the laundry bin as provided. The visit supervisor will escort the visitor out of the courtyard area and beyond the gate. Note, if further transporting assistance for a visitor is required, please ensure this is identified to the scheduler at the time that you set your visit. Assistance with transporting the visitor will be provided if required, because we know that's a long walk around the back. The visit supervisor will then clean and disinfect the visitation booth after each visit and ensure supplies are available for the next visit. At the end of the day, you don't need to know that. Right. Okay, so that is phase 1. I do have outdoor visitor procedures, which I'm going to be sending you, along with a sort of a plan of the building, which identifies the front entrance, the parking area where you're likely to park, and then we want you to use this sidewalk, which goes all the way around the back. There is no sidewalk on this side. Please do not. The ground is uneven, and you could fall or trip easily. So please go around this way. You'll come to Care Center 1, this gate here. Can you see that? This gate here. And if you're going to Care Center 2, just continue on to this gate here.
Just do it this
This
way.
way?
There we go.
Ah, that's better. Okay. So, but I'm going to send that to you as well. So as we mentioned, the visits are all dependent upon weather. So I know that at our last meeting, I had talked about how we monitor the heat and when their residents can go out and can't go out. So I do want to remind you that we will continue to do that, and visits will not happen if the air quality is 7 or higher. All residents must remain inside. If the UV is 7 or higher, the residents must remain indoors during the hours of 11 a.m. and 4 p.m. And if the UV between 3 and 5, outdoors should be limited to 30 minutes. So we talked about what we would do if there was weather issues and you had planned visits. We really do not have the time to call everybody and tell them that their visit is canceled. So please, check the temperature, check the Humidex. Humidex feels like, so if it's 28 degrees Celsius, but feels like 35, anything over 30, we're not allowing the residents out. Also, if there was thunder and lightning, we would cancel a visit. We could do visits in the rain. We have some umbrellas, so that might be a possibility. And I guess if in doubt, just call us or call Amy. She may not always be at her desk, but we will try to get back to you. So please remember that it is very dependent upon the weather. So I'm just going to quickly touch on phase 2A, B, and phase 3, just so you know that it's coming and we are preparing for it. So phase 2A, outdoor visiting expanded. Effective date would be 1 week post lifting of emergency in Ontario under the Emergency Management and Civil Protection Act due to the outbreak of COVID. So when that got lifted, it would be a week, and then the outdoor visiting, you would be allowed 2 visitors. And we must continue scheduling. Process for outdoor visiting expanded phase 2A. The process is identical to phase 1, except that you now have 2 non-essential visitors. Phase 2B, indoor visiting for essential family caregivers only started. So effective date is the same, 1 week after the lifting of the Emergency Management Civil Protection Act is lifted. We will be able to allow essential family caregivers only, 1. And a definition for an essential family caregiver is a person capable of providing caregiving support, feeding, social support, and has done this in the home prior to COVID-19. The person may be a family member, friend, or neighbor. Number of visitors allowed, 1 visitor at a time per resident for indoor visiting. Scheduling of visits is required. So that's all I'm going to cover for phase 2 at this point in time for A and B. So basically, it's outdoor and indoor visits. And the definition has changed from non-essential non-essential visitor to essential family caregiver. For indoor, yes. Phase 3, outdoor visiting and indoor visiting expanded. And this will happen a maximum of 1 month post lifting of the emergency declaration. We can do it earlier if we can accommodate it. The type of visit would be outdoor visiting and indoor visiting. Number of visitors allowed, up to 2 visitors at a time per resident for both indoor and outdoor visiting, provided that the current directives on physical distancing can be accommodated. Scheduling of visits required. We will identify visiting hours at that time, and that we will be so that we can allow for meaningful visits. So at this point in time, we have not decided on how that will work. Because again, we still have to maintain a lot of our protocols, and that is all dependent upon our staff. So I had asked people if they had any questions to send them to me before the meeting. I'm sure there may be questions now. I do want to point out that there's a 90-second lag. So if we're going to wrap up now and then you decide to ask a question, we may not get it because there's this 90-second delay. So if you have any questions, I know it's a lot of information. I've sent you a lot. I'm going to send you some more. We have signage outside, which will help you. Yeah, so Derek, are there any questions?
Nothing's come up.
Yeah.
Okay, I got one. Are we still permitted to do our window visits?
Yes, window visits and Skype. Window visits and Skype and FaceTime will continue with Amy as we can, as much as we can. You have to remember that we're now introducing 64 visits in a week, which require 2 different staff persons. So we're trying to accommodate everybody as much as we can. We recognize that there are some people who live far away and are not able to come down often for a face-to-face visit. So Skype and FaceTime are important. And the window visits, we'll do our very best because, again, this is only giving you 1 visit 30 minutes a week, and we recognize that.
We'll keep the questions open for about another minute or so.
So someone did ask me a question. They asked if when they came, they could bring like a coffee or something for their family member. The answer is no. Please do not bring any food or drink or pets to this visit. That will happen when we open up more. But you can bring your treats to the vestibule like you've been doing. We'll leave it there for 3 days, sanitize it, and then deliver it to your loved one.
Now the questions come in. Can a family have an extra visit if there is a slot that appears open?
Yes. So what we would like to do is, if you could, for those who can, if you could set your date with Amy, and it could be on an ongoing basis, that same time slot, that would probably be a really good idea. We recognize that not all 64 residents will have visitors, so there will be other time slots. But we want to make sure that we give everybody a chance to have at least 1 visit, and then the slots that are left available, you can fill in on those. You're going to have to bear with us for a little bit until we get the hang of it. So please don't get impatient with Amy. She's working very hard. We're all working very hard to try and make this successful. Anything I didn't say, I didn't think of. Oh yes, I do have one thing to say. Window visits. I know when you're doing it at the big window, it's not a concern, but when you're visiting a resident at their bedroom window, please keep the window closed. We're talking about a virus that is a droplet. So by opening the window and talking through the window, you're actually putting your loved one at risk because it is a droplet. So please do not ask anyone to open the window. They must remain closed. Also, they need to remain closed because we want to keep the heat out and keep it cool. Essential visitors, which is defined, which hasn't changed, is defined as, where will I find it? My essential visitor. is defined as someone who's coming in like to do blood or to, do you know what page that's on? Or
It's
to,
near the beginning.
yeah, that's what I thought.
Two or three.
Sorry, I was just looking for the definition of essential visitor. Where's the definitions? Anyway, that doesn't change. Essential visitor would be someone who is visiting someone who is end of life. Right above non-essential visitor. So essential visitors continue to include persons performing essential support services, food delivery, inspectors, maintenance, healthcare services like phlebotomy, taking blood, or a person visiting a very ill or palliative resident. The only visitor permitted in the home during an outbreak or when a resident is self-isolating or symptomatic is an essential visitor who passes the screening test. So that has not changed. They consider family members at this point non-essential visitors.
We haven't had any more questions, so.
Oh, that's good.
For those that are listening, the staff is always available by email or by phone. And that's always our primary interest is to make sure that your loved one is cared for in the greatest way. So I think we'll wrap up.
Yeah, but please feel free to drop me an email if you think of a question after this.
Okay, thank you, everybody.
Thank you.